On this week's episode, we're going to be talking about hamstring injury and prevention. Oh man. We can just keep doing this, Rob. This feels great. And today I'm with Dr. Rob. We are talking about hamstrings. So we all know we have hamstrings. We're going to talk about the importance of a hamstring. So if you could kind of go into why it's important or how it functions.
Well, any movement of the lower body, you're going to need your hamstring. So its main job is it's an extensor of the hip and the flexor of the knee, but anything like walking, running, jumping, and some movements of the trunk, it's going to control those movements.
Okay, so in the office, what kind of hamstring injuries do we see?
We'll mainly see like more strain injuries than anything else. Usually have to grade them like a 1, 2, or 3 strain depending on like the severity of the injury.
So is it from like a physical activity, or could it be?
A lot of them will happen like rapid acceleration. So like right when you first start running, that's when a lot of hamstring injuries.
So quick movements. So prepping beforehand is important, which I think we're going to talk about that later. Yeah, totally. Okay, so mobilizing versus strengthening. I hear, both are great for muscles. Why is it important to do that for hamstrings?
You want to make sure to have a mobile hamstring. It inserts on the bottom of the pelvis. So if it is really tight, it can change how the pelvis rotates with activities like walking and running. From a strength standpoint, if you can't really use the hamstring well to pull your leg back, you can set yourself up for some quad injuries as well.
Okay, so I guess I have heard tight hamstrings can also lead to low back pain.
And a lot of times, like if people's glutes aren't firing the way that they should, they'll overuse their hamstrings and their low back, and that's when they'll get a lot of that pinching pain in the low back as well. Okay, all right, so mobilizing, strengthening, definitely important for the hamstring. We're going to talk about some movements like for prep work later on. Rainy's Fitbit is up next.
Hi, I'm Rainy. Welcome to the Fitbit of the Week. This week we're talking about hamstring injuries. So I'm going to go over 4 different ways to stretch your hamstrings and kind of talk about the difference of static stretching versus dynamic stretching. So first of all, if you have just injured your hamstring, you want to make sure that you can walk pain-free before you start stretching it, because then you don't want to stretch too far, injure it more. So okay, let's pretend you have gone a few weeks that you can walk now and it's pain-free. So first we go into static stretching. So that's the first thing you'd want to do after your pain-free walking. Static stretching is what most people think of when they talk about stretching, where you sit in a position and then hold it for a certain amount of time. So the 2 static stretches that we're going to do today are a basic straight leg hamstring stretch. We're going to use the stretching strap again today. So what I'm going to do is lay on my back, put this right on the bottom of my foot, try to keep my leg as straight as I can. And again, we'll pretend I have the hamstring injury. You just want to raise it very slowly. You only want to go to the point of where you do feel a stretch, but it's a comfortable feeling. It's not painful and pulling really hard, because again, right now, all we're trying to work on is create more elasticity in the muscle that you've injured and not like increase the flexibility and really try to pull on it. We don't want to hurt it more than it already is. So just nice, gentle stretching. Again, hold it at the top for 20, 30 seconds, relax, do it a couple times. All right, so that's the first one. The second static stretch is a bent leg stretch. So for this one, again on your back, but we're gonna keep the knee bent, and we're just gonna put your hands kind of behind the knee and pull it toward your chest. So for this stretch, you're actually gonna feel the stretch or the tension more at the top of the hamstring or closer to the glutes up here by the hips. With the other one, I was feeling it closer to the knee or, at the bottom of the hamstring. So again, this one, pull gently, start slow, and then hold it there for 20, 30 seconds, and then do it a few times. All right, so those are the 2 static stretches. Then we're gonna move to dynamic stretches. So a dynamic stretch is kind of like a stretch with movement. So the first stretch that we're gonna do is just like a leg swing. I would suggest holding on to something for this one because you're gonna be standing on one leg. And you're just gonna gently, start slow again, gently raise the leg up, rest it back down, up, down. This one we're not holding at the top, we're just keeping the muscle moving. All right, so you just wanna do several reps in a row before you switch to the other side or rest, whatever that you're doing, just like so. And then the last dynamic stretch that we're gonna do is called a good morning. So what you're gonna need is this is PVC pipe, this is what we have here. If you have like a broomstick or something at home, you're just gonna rest it on your shoulders, almost like if you were doing back squats or something. And what we're gonna do is keep our feet about hip width apart. We're going to press our hips back, kind of like bending over, but I want you to keep your chest up so that your back stays straight. We don't want you to round over your back this way. You're gonna feel pain in the low back probably. But as you lean forward and press the hips back, you're gonna feel tension here in your hamstrings. So you're just gonna bend over, come up, down, up. Again, you're not holding this one, you're doing movement, so you're doing multiple reps, one right after another. All right? So again, I wanna remind you, if you have just been injured, first make sure that you can walk pain-free. Then we move to static stretching. Take it nice and easy once you can get through the static stretches comfortably without pain. Then you move to the dynamic stretching with movement. And then after that, you should be good to go. Maybe you're not feeling the pain anymore and you're ready to start working out again. All right, so that's been this week's Fitbit, and we'll see you next time.
All right, so we're back. Dr. Rob is going to show me a in-office assessment of a hamstring injury or somebody coming in complaining about hamstring tightness.
There's one simple test we would do with people just to assess hamstring length is first we would have the person bend forward and touch their toes. So I'm gonna have you do that. Okay, that looks really good. But for the purposes of this, let's say you only got to about here. So what we would do next is I'm gonna have you stand with the right leg up like this, and then the same thing, I would have you bend down, touch your toe to essentially see, is it one hamstring versus the other, or is it both?
So what could this be caused by? Why would one hamstring be tighter than the other?
If somebody has had an injury and maybe they've had a strain in the past, it's healed with a little bit of scar tissue. That scar tissue isn't going to be as flexible as a normal muscle fiber.
Okay.
So that's a lot of times what we would see.
Okay, injury, overuse, over time or something, yeah. Or okay, all right. So one side and then the other.
We do the other one too. Same kind of thing. Is that one a little tighter?
Yeah, I actually feel my right side's tighter.
Might have to work on that.
Yeah. Okay, so that would be an assessment, and then you would kind of go into a treatment plan after that.
Yeah, depending on what's going on with them, and usually things like Graston and laser, if we can combine those, we can break up the scar tissue pretty quick, and essentially the laser will speed up healing.
Okay. So we've shown laser and we've shown Graston in other episodes, so make sure to check those out. So now we're going to go over some movement prep. Earlier we talked about if a lot of hamstring injuries are incurred by just a really quick, rapid movement. Mm-hmm. So what should somebody do to kind of prep?
I mean, always making sure to warm up before just jumping into exercise. A couple we were going to go over today. One was called an inchworm. So essentially, what I would have you do, bend down, and I would just have you crawl your hands out to essentially like a push-up position.
Okay. I did not wear the proper shirt today for this.
Makes it a little tougher.
So out,
and then have you walk the feet up. And with that, I would just have you do that until you felt some stretch in the hamstring, and then just crawl back out. You don't have to walk all the way up.
Okay. All right, good.
And then the second one that we were talking about, essentially just bring the leg up and just almost like marching forward.
Okay. All right, this one I think I can do.
You're good on that one.
That's better. Okay.
Good.
Yeah. So some quick, really easy movement prep beforehand. You'll wish you did it if all of a sudden you go for a quick sprint and you just feel pain.
Feel pop.
Yeah, in your back leg. All right, so that's all we have for this week. We will see you next time.
To submit a question, watch a past episode, or to find out more about the Springfield Wellness Center, check us out on Facebook, subscribe to our YouTube channel, or find us on Instagram, or check out our show website at wellnesslab.tv.